Our vision is simple. It's best health for our population and prosperity for our region. Our mission to deliver that vision is to support collaboration, research and innovation across the three main groups of the NHS, universities and the life science industry. And we build on our strengths there to deliver exemplary care and develop and create the strongest life science cluster. So it's been quite a while in getting going. It's looking back at it 2 years since the original guidance on the AHSNs and their role was produced. But I think in the last 6 months, since we've had the team in place, and particularly since I've been well supported by Paul Durrans, we've been able to make excellent progress. So I think in the challenges ahead, and there's definitely challenges in the current environment, we are supported by real ambition in our partners, and that's, I think, both in NHS providers, commissioners, and the universities and industry. We have a full team in place. Our major programs have been initiated. We have a simple but clear governance arrangement. We've not gone down the complexities of some of the HSNs have done of forming a company by limited guarantee, and we have good engagement and it's increasing across the HSN. So you should all have a copy of the annual report, and you can see all the details in there and on our website. You can also follow us on Twitter, and just to say, we have a monthly newsletter and we welcome contributions from any of the partners to that. So we've aligned our programs of work to the 4 licence objectives. And I'd just also like to note that the Partnership Council, which is this group, is the formal body which receives our annual report. So just to talk about our wealth creation work, we undertake this in close partnership with the local enterprise partnerships and the local authorities, with the Oxford Bioscience Network, which we're very lucky to have in our patch, and the Oxford Academic Health Science Centre. We put up here 2 examples of innovations developed by local companies which have been supported by the Small Business Research Initiative providing funding. One is a patient monitoring system by Isansis Lifecare Limited, and the other is developing a new blood test to reduce unnecessary invasive procedures for bowel cancer screening. In the last round of SBRI funding, we had 9 companies who were successful in obtaining funding from within the patch, and that's the largest number of companies funded than any other HSN. So we have a really vibrant life science industry. In terms of our partnership and collaboration working, we are looking to bring together and support the development of effective partnerships between NHS trusts and the universities in our patch. And we have our first formal meeting of the R&D group chaired by Sir Jonathan Michael early next month. I'm going to describe our work on needs of patients and speeding up adoption of innovation in the next few slides. So in delivering the Best Care programme, we have taken the focus of creating and supporting clinical networks that will drive the delivery of high quality care and support the introduction of innovation to support that across the patch. In that work, we work in close partnership with Health Education Thames Valley, who funded the Fellowships in Evidence-Based Healthcare and the Patient Safety Academy, and the strategic clinical networks which deal with the 4 key clinical areas. One network we added to the 9 that were had been started to develop before I came into post is the Out of Hospital network, and you'll hear more about that from Dan Lasserson later on. And that was very much to help commissioners, NHS providers and local authorities meet the challenges of implementing the Better Care Fund, aiming to deliver more care in the community closer to the patient's home. We are very informed in what we do by the strategic priorities of our partners. This slide shows the priorities of our NHS providers and CCGs. And I'm pleased to say, for all the areas of high priority, we are undertaking work in either the clinical networks or the Clinical Innovation Adoption Programme, or both. And I think in future years we will look to expand our work to address some of the medium priorities, such as supporting people with learning disabilities, respiratory diseases and obesity. So our Clinical Innovation Adoption Programme, the approach we've taken here is to take a targeted approach and to identify 10 innovations each year that we will support implementation across the HSN area. These 10 have been drawn from a long list of 300 innovations, a mix of NICE technology appraisals and then other guidance issued from NHS England or other quarters describing innovations that are of benefit and the NHS should provide. And we very much draw upon the expertise of our commissioners and providers to support our programme of innovation adoption. And the other thing we seek to do here is to empower our patients to improve the work we do in this. So if you look through the innovations, we have 4 NICE TAs addressing management of atrial fibrillation, cancer, arthritis and dementia, and then 6 others. One was one of the high impact innovations, intraoperative fluid management. Others are recent innovations where there's an evidence base, such as intermittent pneumatic compression stockings for stroke, and 2 are local innovations, a social network for people with eating disorders, which is professionally supported, and electronic blood transfusion safety system. So I think I'd like to finish by saying that we see patient engagement and involvement as critical to all that we do, which is why we have a cross-cutting theme of work of public-patient involvement, engagement and experience. And to use the mantra, we do wish to see no decision about patients without their involvement. And our focus is very much on supporting delivery of high quality, compassionate and safe care. We also need to use high quality accessible data to empower our patients and our staff in all the work they do. And I would like to see a situation where any patient who wants to hold their own healthcare record is able to obtain an electronic copy of that. And we do need robust data from that aggregated patient held data to know what is happening to patient outcomes and experience as they experience care in our healthcare system. But I think we also need to empower the 65,000 staff who work in our NHS partners to innovate and change. And we need to robustly evaluate everything that we do. And I think the final thing I'd like to say is we need to not fear failure, and we need to learn from those projects and initiatives that we undertake that don't work, and we need to share that experience. And I think the NHS has not been very good at learning from failure, acknowledging it, and then using that to develop really excellent care. And I'll finish with a quote from Bill Clinton, which was, "It's fine to celebrate success, but it's more important to heed the lessons of failure." Thank you.